Living with type 2 diabetes can be a challenge, but advancements in modern medicine have brought new hope to those managing the condition. Two innovative medications, Januvia and Invokana, have emerged as popular options for diabetic patients seeking effective ways to control blood sugar levels. In this video, we will explore the key differences between Januvia and Invokana and help you make an informed decision about which medication might be best for you. Overview of Januvia and Invokana medications. Januvia and Invokana are both prescription medications used to treat type 2 diabetes. They belong to a class of drugs known as incretin enhancers, which work by targeting different mechanisms in the body to help regulate blood sugar levels. Januvia, also known by its generic name sitagliptin, is a brand name medication that increases the production of insulin, a hormone that helps control glucose levels. It belongs to the class of drugs known as dipeptide L-peptidase 4, DPP4, inhibitors. Januvia is typically taken once daily and can be used alone or in combination with other diabetes medications. On the other hand, Invokana, also known as canagliflozin, is a brand name medication that belongs to a class of drugs called sodium glucose cotransporter 2, SGLT2, inhibitors. Unlike Januvia, Invokana works by inhibiting the reabsorption of glucose in the kidneys, allowing excess glucose to be eliminated through urine. Invokana is taken once daily and can also be used alone or in combination with other diabetes medications. How do Januvia and Invokana work in managing type 2 diabetes? Januvia and Invokana target different mechanisms in the body to help manage type 2 diabetes. Understanding how these medications work can help you determine which one may be more suitable for your specific needs. Januvia works by increasing the production of insulin in the body. Insulin is a hormone that helps regulate glucose levels by allowing cells to take in and use glucose for energy. In people with type 2 diabetes, the body may not produce enough insulin or may not use it effectively. Januvia helps stimulate the release of insulin from the pancreas, which can lower blood sugar levels. Additionally, Januvia can also reduce the production of glucose by the liver, further aiding in glucose control. On the other hand, Invokana works by inhibiting the reabsorption of glucose in the kidneys. Normally, the kidneys reabsorb glucose from the urine and return it to the bloodstream. Invokana blocks a protein called SGLT2, which is responsible for this reabsorption process. By inhibiting SGLT2, Invokana allows excess glucose to be excreted through urine, reducing blood sugar levels. Effectiveness and safety of Januvia in controlling blood sugar levels. Januvia has been shown to be effective in controlling blood sugar levels in people with type 2 diabetes. Clinical studies have demonstrated that Januvia can significantly reduce A1C levels, which is a measure of average blood sugar levels over a period of time. In one study, patients taking Januvia experienced a mean reduction in A1C of 0.7% compared to placebo. Januvia is generally well tolerated, with the most common side effects including headache, upper respiratory tract infection, and gastrointestinal symptoms such as nausea and diarrhea. In rare cases, Januvia can cause more severe side effects, such as pancreatitis or allergic reactions. It is important to discuss any potential risks or concerns with your healthcare provider before starting Januvia. Effectiveness and safety of Invokana in controlling blood sugar levels. Like Januvia, Invokana has also been shown to be effective in lowering blood sugar levels in people with type 2 diabetes. Clinical trials have demonstrated that Invokana can significantly reduce A1C levels. In one study, patients taking Invokana experienced a mean reduction in A1C of 0.7% compared to placebo. In terms of safety, Invokana has been associated with certain risks and side effects. One notable side effect is an increased risk of urinary tract infections, which can occur due to the elimination of glucose through urine. Other common side effects of Invokana include genital yeast infections, increased urination, and low blood pressure. It is important to be aware of these potential side effects and discuss them with your healthcare provider. Comparing the side effects of Januvia and Invokana. While both Januvia and Invokana are generally well tolerated, they do carry some risks and potential side effects. It is important to compare and consider these side effects when deciding which medication may be more suitable for you. Januvia's most common side effects include headache, upper respiratory tract infection, and gastrointestinal symptoms such as nausea and diarrhea. Some rare but serious side effects of Januvia include pancreatitis and allergic reactions. On the other hand, Invokana's common side effects include urinary tract infections, genital yeast infections, increased urination, and low blood pressure. Additionally, Invokana has been associated with an increased risk of ketoacidosis, a serious condition characterized by the buildup of acid in the blood. When considering the potential side effects of both medications, it is essential to discuss your individual medical history and any pre-existing conditions with your healthcare provider. They can provide personalized guidance on which medication may be the safest and most effective option for you. Choosing between Januvia and Invokana. Factors to consider. When deciding between Januvia and Invokana, it is important to consider several factors that may influence your choice. These factors include mechanism of action. Januvia increases insulin production, while Invokana inhibits glucose reabsorption in the kidneys. Understanding how each medication works can help you determine which mechanism aligns better with your needs and preferences. Side effects. Consider the potential side effects of each medication and discuss them with your healthcare provider. Be aware of any existing medical conditions or allergies that may increase your risk of experiencing certain side effects. Safety concerns. Certain risks, such as an increased risk of urinary tract infections with Invokana or the potential for pancreatitis with Januvia, may be more relevant to your individual health profile. Discuss these risks with your healthcare provider to make an informed decision. Other medications. Consider any other medications you are currently taking and discuss potential interactions with your healthcare provider. Some medications may interact with Januvia or Invokana, affecting their effectiveness or increasing the risk of side effects. Personal preferences. Your personal preferences, such as dosing frequency or administration method, may also play a role in your decision. Januvia is typically taken once daily as a pill, while Invokana is also taken once daily but in the form of a tablet. Ultimately, the choice between Januvia and Invokana should be made in consultation with your healthcare provider, taking into account your individual health profile and needs. Discussing Januvia and Invokana with your healthcare provider. Before starting any new medication, it is crucial to have an open and honest discussion with your healthcare provider. They can provide valuable insights and recommendations based on your individual health profile, medical history, and treatment goals. During your conversation, be sure to discuss your current diabetes management plan, including any medications you are currently taking. Your healthcare provider can assess whether Januvia or Invokana would be a suitable addition to your existing treatment regimen or if other options may be more appropriate. Additionally, be prepared to discuss any potential side effects or concerns you may have. Your healthcare provider can address these concerns and provide guidance on how to manage any side effects that may arise. Remember, your healthcare provider is your partner in managing your type 2 diabetes. By having an open and collaborative discussion, you can work together to determine the best medication option for your needs. Other treatment options for type 2 diabetes. While Januvia and Invokana are innovative and effective medications for managing type 2 diabetes, they are not the only treatment options available. It is important to be aware of other treatment modalities that may be suitable for your specific needs. Some alternative treatment options for type 2 diabetes include metformin. Metformin is a commonly prescribed medication for type 2 diabetes. It works by reducing glucose production in the liver and improving the body's sensitivity to insulin. GLP-1 receptor agonists. GLP-1 receptor agonists are injectable medications that stimulate the release of insulin and reduce glucose production. They can also help with weight loss and have a lower risk of hypoglycemia compared to some other diabetes medications. Insulin therapy. For some individuals with type 2 diabetes, insulin therapy may be necessary to achieve optimal blood sugar control. Insulin can be administered through injections or an insulin pump. Lifestyle modifications. Alongside medication, lifestyle modifications play a crucial role in managing type 2 diabetes. These may include adopting a healthy diet, engaging in regular physical activity, maintaining a healthy weight, and managing stress levels. It is important to discuss these treatment options with your healthcare provider to determine the best approach for your specific needs. They can provide guidance on combining different modalities and help create a comprehensive treatment plan. Conclusion: making an informed decision for your type 2 diabetes management. Januvia and Invokana are two innovative medications that have revolutionized the treatment of type 2 diabetes. By understanding their mechanisms of action, comparing their benefits and side effects, and considering personal factors, you can make an informed decision with the guidance of your healthcare provider. Remember, there is no one-size-fits-all approach to managing type 2 diabetes. Each individual is unique, and treatment plans should be tailored to suit specific needs and preferences. By staying informed and empowered, you can take control of your type 2 diabetes management and lead a healthier, more fulfilling life.